Hello and welcome to another recorded training session for RPMS EHR. My name is Katie Johnson and I am the EHR Integrated Care Coordinator at the Northwest Portland Area Indian Health Board. In this session, we will be covering patient and visit selection. Time for my disclaimer. In all of these recordings, the database that I am using is a scrambled training database. It contains no real patient information. The data may look real, but it is not. After logging in to EHR, we are going to navigate to the patient chart. And the two boxes along the top here that we're going to focus on are our patient selection box, that is this blue one, and our visit selection box, that is this yellow one. To select a patient, the very first thing that you want to do is click on the box, the blue box in this case. It will bring up this dialog here that allows you to search all of the patients that are in the database. Now there are a few different ways to pull up a patient. I'm going to cover the different ways. Probably the most straightforward way is to use the patient's name. You can just start typing here in the box, and the EHR will narrow down the list of patients based on what you type. If you're not sure how to spell the patient's name, it's better to just go with the first few letters and kind of let it narrow it down for you, and then you can, don't rush it, let it kind of find that particular area, and then maybe you can find it just within the list, or you can type another letter to narrow it down further. Be careful just typing the whole last name and first name unless you're sure what it is. The only reason I say that is the format here is last name, comma, first name, no spaces, and it doesn't really tolerate any typos or misspellings. It's very literal, and there's no kind of wildcard search that you can do if you're not sure how to spell a patient's name. So for example, if you thought it was Smith was the last name, and the first name was Joe, and I did this, it's not even kind of giving me many options here. And then maybe you type a little bit and you realize, oh, in this case, Smith is spelled with a Y. And so maybe you can start scrolling, or you can back up your typing and get you a little bit closer. What you cannot do, what I've seen some people try to do, is if you're not sure of the spelling of the name, but you want the system to just, search it more widely, what this one won't do is something like SM and then comma JO and have it just kind of search, the wildcard type situations like this. It won't do that for you. It kind of confuses it. As you can see, it'll just give you, it's just going off of that SM, the first thing I typed there. So the name search is common, can be really easy. Just type a few letters and let it find it and go from there. Now the second way to do it is simply with the chart number. If you have the chart number handy for the patient, you can simply type it in and it will go to that patient. And as you can see, I didn't point this out in the last one. When you have a patient selected, it gives you a little bit of information here to help you verify that you are on the right track to getting the right patient. Gives you the date of birth, age, sex, and the chart number. Just in this little demographics screen here. If you want a little bit more detail, you can click on this patient detail here. And this actually will bring up a health summary for you. So that's just kind of a side note. May or may not be useful to you, but I did just want to point that out. Might be a shortcut for you in some instances. Okay, back to selecting our patient. We've done name, chart number. The third way is by date of birth. This one sometimes gets forgotten because it's not obvious that you can search by date of birth, and the format is very specific. So if you have the patient's date of birth, the way that you search it in here is with a capital B and then the date of birth in the month, day, and then either 4-digit year or 2-digit year. Either one works. If you type that in, it'll find that date of birth if it exists in the system. In this case, we have one hit. I wanted to show you as well what would happen if there is more than one patient with that exact birthday. In this case, there are 2 patients with this birth date. It's showing them both to me as I typed it in. So then I can go from there to select which one I want. So those are the ways of just directly searching for the patient, but probably the most common ways that will pull up a patient is by using this clinic list, patient lists, based on what clinic they have an appointment in for the day. In this case, I have one called Demo Clinic here, and these 3 patients all have appointments scheduled in this clinic on today, because here we see the list appointments for, and you can adjust the time range, but most likely you're going to be looking at today. And this just basically gives you, it's just a shorter list to look at. It can be very helpful. You can default, if you're always working in the same clinic, you can have a default clinic like it does in this situation, but you certainly don't have to do that. You can also, I have this hide empty lists checked, but in this case, you do have access to all the different clinics here, even if you have a default set. That it doesn't matter, because you can switch around to whatever other clinic you might want to look at. In this case, none of these other ones have any patients scheduled for today. So looking at our demo clinic, I have 3 patients to choose from in these examples. And like I said, that's probably the most common way that just day to day that you pull up a patient. Now it is time to talk about the visit selection. And I want to point out the difference between choosing a patient off of this clinic list versus choosing a patient by just typing in their name or their chart number or their date of birth. The difference is when you actually select the patient and what happens with this yellow visit box. So if I choose a patient off of the list here for my clinic and I select OK, it put my patient in this blue box here, and it populated the yellow box, the visit box, with the clinic that the patient is scheduled in and their appointment time and things like that. So I want to contrast that with just typing in and going directly to that patient. And I also want to note here that so even though I'm looking at a clinic list, I always have access to pull up any patient on the list, at any time. So here I just typed in a chart number. I'm going to select OK. And notice since I did not choose this patient off of a clinic list, it did not populate this visit box because it didn't, I didn't tell it which visit context I was wanting to pull up the patient in. And that's fine. But in order to do, like if you're just looking around in EHR here, you just needed to look something up, the patient's allergy or something like that, then you might not need a visit. But pretty much to do anything in EHR, you need a visit selected. So it's probably best to get in the habit of just select the patient, select the visit. If you need to do something with this patient, like write a note, order a lab, order a medicine, anything like that. Now, if the patient is scheduled and has a visit scheduled, like for today, then it will show up actually here on this appointments and visits tab. But and you could select the visit, whatever was on this in this list that's blank in this example, and then you've selected your visit and gone on about your way. But there are some times when you need to create a visit. Now this would be something to check with your local clinic and their policies and procedures surrounding visit selection and visit creation. But for the most part, you only are going to need to make a new visit when it's something like a chart review or a telephone call. So not a face-to-face visit with the patient, just you need to go in and maybe there was an abnormal lab that you need to follow up on, and then maybe you make a letter for the patient to notify them, or maybe there was a request for a refill that the provider needed to address, or something like that, where you needed to order something and maybe write a little note, but you didn't actually see the patient. Those would be the times that you would create a chart review visit. So you would find chart review here, or the other very common one might be telephone call. The patient called you, you discussed something, and you wanted to make a little note in the chart, something like that. So chart review and telephone call are the common ones here. You can click the Create a Visit Now box. Choose yourself as provider either by double-clicking on your name or by using the arrow to move yourself under the providers for this encounter. And in general, you never are creating clinic visits in EHR, like for your regular clinic. Those, in most cases, need to be generated through the check-in process. The patient comes in and gets checked in, and then the visit is visible, and then you can choose it in EHR instead of creating it in EHR. So that's the difference there, choosing it off of a list under appointments and visits, or creating a new one here. There are always going to be exceptions to the rule, or days where a glitch happens, or something like that. But the rule of thumb is really the only new visits that you need to create are chart reviews and telephone calls for the most part. So now I'm going to say OK, create my chart review visit. And you see there it created my visit, it populated this yellow box, and now I'm ready to go on and do whatever I needed to do in the chart today. Okay, so that sums it up for today. Okay, well that sums up this recording. Just wanted to cover selecting a patient and a visit. Remember, we can select the patient by typing in their name, their chart number, their date of birth, or choosing them off of a clinic list. And then based on how we looked up the patient, if we chose them off the clinic list, we don't need to worry about the visit box because it is selected for us. If we, however, just typed in a patient's name and selected them just from the overall list, then we will need to decide what kind of visit we need and populate the visit selection box this way. Thank you for your time.